World Cancer Day webinar, United by Unique. We are very excited to partner with the Occupational Cancer Research Centre, and really, truly everyone has been and continues to be impacted by cancer. And what is underreported is the occupational piece of cancer. And so we're hoping to change that. And a lot of the findings as we enter into February, and we leave behind a very long January, as it tends to be. We did want to recognize January having been Firefighter Cancer Awareness Month, and just acknowledge all the past work that both OCRC and OCCOW have done in partnership and separately with the firefighters, and a lot of change afoot in that regard, based on some workshops that OCRC led out. They'll be speaking about that later, and Health Canada as well. OCCOW has been invited to participate in a best brains exchange that came out of that workshop effort. And we have a long history with helping bring to light and the cancer in firefighters. You know, the Hamilton Clinic has worked back with firefighters for ages, Plastomet Fire and others. We have clinical cases coming in every day that we're helping firefighters. And we just wanted to acknowledge a lot of the changes going on in that regard, and OCCOW's continued effort along with OCRC's. And really a lot of that, the findings from some of those workshops and this Best Brains Exchange that Health Canada is hosting are really around knowledge translation. So that's why we wanted to come to you today and really get information out there for you to be part of as the knowledge translation. So at the impact from cancer, today's not just about firefighters, but as we enter February, and we wanted to acknowledge the January Cancer Awareness Month. And we want to improve awareness, we want to provide resources and tools, and as we all collaborate and innovate, make the change together that we can. So I am going to now welcome you with a land acknowledgement to today's webinar, and hope that someone can throw in the chat or on the screen, if easier. I think it'd be nicer, a visual to go along with that land acknowledgement. I am, and always forget to introduce myself, I'm Kimberly O'Connell. I'm an occupational hygienist by trade and executive director for Occupational Health Clinics for Ontario workers. I lead out occupational illness prevention efforts both at OCCOW and provincially with the OC Illness Prevention Steering Committee and the OC Illness Leadership Table at the Ministry. And you're going to hear from our team at the end of today's session with a new launch of our silica control tool marketing that will help hopefully with this awareness effort, and not only awareness of occupational illness, occupational cancer, but doing something about it, controlling exposures. So today we are participating in this meeting from a number of locations across the province and beyond. I want to acknowledge that I'm connecting today from Mississippi Mills. We acknowledge that this sacred land on which Mississippi Mills is now located has been a site of human activity for over 10,000 years and is rich in Indigenous history. This land is ancestral and unceded territory of the Algonquin Anishinaabe Nation. We're grateful to the Algonquin ancestors who cared for the land and water in order that we might be here today. I was in my local coffee shop and stumbled upon this art installation that reminds us that through art we reconcile, reconnect, and rebuild. It's one location of a national art installation called the Canadian Library. The Indigenous designed fabrics cover the books in the bookcases and are a reflection of the unique lives of the women whose names are embossed on the books. The memories of the women, as told by their loved ones, resonate on the stunning reality all across Canada. The need in society to be part of the solution and help take part is realized by the many hands who helped cover and create the art pieces. These beautiful bookcases are stunning mementos that will never let us forget the murdered and missing women of Canada. It is my pleasure to now introduce our speakers from the Occupational Cancer Research Centre. Giovanna, Giovanna, I practiced this.
Sridhar, okay.
Sridhar, I say it quickly and then I'm going to get it right, and I don't. I really don't. Is a scientist at the Occupational Cancer Research Centre, and she's also an assistant professor at the University of Toronto's Della Lana School of Public Health. She leads the Occupational Disease Surveillance Program at the OCRC to examine various cancers and non-malignant diseases in the Ontario worker population. She is joined by Kate Jardine, the Knowledge Translation and Exchange Lead, and Kate has been helping us with this item of knowledge translation that our theme is around today, along with UnitedbyUnique, which we think we are as partners, OCRC and OCOW. Kate Jardine is the Knowledge Translation and Exchange Lead at the Occupational Cancer Research Centre. She leads OCRC's KTE program, including the development of KTE plans, products, and dissemination strategies to support the center's research projects. Welcome both. Thank you for coming.
Thanks, Kimberly. I'm just going to share my screen. There we go. Can you see my screen? Yes. Okay, perfect. I can't see anyone, so that's great. Thank you. So our topic today is about occupational cancer risks among male and female workers, and really to enhance knowledge translation and prevention through our center. So the OCRC, the Occupational Cancer Research Centre, is based at Ontario Health, and it is a unique partnership that really unites research, healthcare, workplace safety, labor, and industry groups. And the mission of our centre is to enhance the understanding of occupational exposures and workers who are at risk, and to ultimately improve occupational disease prevention and compensation. And our center is focused on increasing occupational cancer research capacity. And more recently, we've expanded to include other occupational diseases and risk factors. So we'll be presenting some findings from our occupational disease surveillance system, which we often refer to as the ODSS, which was created through an agreement through the Ministries of Labour and Ministry of Health to develop systems to monitor trends and patterns of occupational disease in Ontario. So at its conception, no other system in Canada was designed to include work and health information for examining the risks of occupational disease among workers. And so the purpose of the system is to identify at-risk workers and occupational risk factors, ultimately to inform prevention activities. And the system, oh, go ahead. Okay, so the system is funded by the Ministry of Labour, Immigration, Training and Skills Development and the Ministry of Health. The initial pilot was funded by the Public Health Agency of Canada and WSIB for various projects, or have been funded by these agencies as we move forward using the system. So we created the Occupational Disease Surveillance System, sometimes we call it ODSS, as I mentioned, as the first of its kind in Canada, and we're able to link information, work information to health records in a cohort size of about 2.37 million workers, and approximately 800,000 are female workers. And we often update this cohort with additional years of data every 3 to 5 years. So the ODSS was created by linking a series of administrative health databases that are listed here, and has been used successfully to examine risks of several cancers and other non-cancer outcomes by occupation and industry. And so the ODSS links data on accepted lost time compensation claims records to health records. And these health records include doctor visits, hospitalizations, emergency department visits, and cancer records. The information on occupation and industry are obtained through the workers' compensation records, while diagnostic information to identify diseases of interest are identified through the various health databases mentioned here. Specifically for cancer, we link to the Ontario Cancer Registry to identify cancer diagnoses in the province. And all of this data is linked to the Registered Persons Database, which gives us information on death, immigration out of the province of Ontario, and health insurance number, which for those who are registered to provincial health insurance. So here you can also see the various years that are listed, which indicates the different years of data that we have available at Ontario Health. And right now we're in the process of updating this data to include 2022 and 2023 records. So here are some examples of cancers that we can investigate in the ODSS, the Occupational Disease Surveillance System. And we can look at both common and rare cancers generally pretty well given the size of our surveillance system. We've been successful in looking at most of those listed here, but again, we don't just look at cancer, we've expanded out to look at non-malignant diseases. So beyond cancer, we also now look at things like asthma, dermatitis, COPD, COVID-19, and opioid-related harms. To examine the risk of occupational cancers among workers, we run Cox models where occupation and industry in our system is coded at 3 different levels. So division being our more broad grouping, major being our more intermediate, and minor level being our more specific or narrow job title. So here you can just see the example for occupations because today we're going to share some of the results based on occupational groups and not industry. And so we have the ability to examine hundreds of occupation and industry groups. And this is because we have specific coding for these, but we also have multiple different coding systems currently available that we're working on in the ODSS. And sometimes it can be challenging to potentially weed out specific exposures because we know that there are multiple different occupations and at times people can have more than one occupation over the time period that we're capturing. All of our models are adjusted for age and age at start of follow-up and birth year, and in some cases sex if we're interested in looking at the overall group. But unfortunately, our system does not have information on smoking or other behavioral factors because it's based on administrative health records. For some analyses, such as lung cancer, we have performed indirect adjustment for cigarette smoking using prevalence estimates based on other provincial health data. So for example, we've used the Canadian Community Health Survey data that collected smoking data, and we were able to indirectly adjust for this in our results. So the next set of slides, I'm going to share some of our important findings that we wanted to highlight today. And then Kate will kind of go into sort of the knowledge translation and exchange based on some of the work that we're doing. So what you'll see here for leukemia, for example, is you can see that we're showing this by sex. So we wanted to be able to show this among females and males with an emphasis on the female workers. And here, so you can see this for leukemia. Although we know there's a significant body of evidence where certain occupational exposures have been associated to leukemia, such as benzene, formaldehyde, or ionizing radiation, we still need more research to understand and identify these work environments that potentially could increase the risk of leukemia among these workers, particularly by sex. So we've recently examined the risk of leukemia among females and males employed in various occupations. For example, here, motor transport operating, mechanical and repair work, and metal machining all had higher risks of leukemia compared to other workers in the ODSS. So we often compare them to everyone else who's captured in our surveillance system. We also saw higher risks observed among female workers in sales, as well as males in protective services, among other occupations that are not listed here. And generally what we find in protective services is these are driven by those in firefighting or police. We also have the ability to examine risk of leukemia, risk of leukemia subtype, which demonstrated some consistent findings. For example, here you can see this for motor transport operating. And we know that this is important given that we don't have much in the literature where we can attribute some of these risks among subtypes to work exposures. And what we're finding for motor transport operating, for example, is that this is primarily driven by truck drivers and other types of drivers. So given our large sample size in the cohort, we do have the ability to really dig into the data. And in this study, for example, for leukemia, we know this may be due to variations in exposures by sex, but also other non-occupational risk factors that we can't account for. And I'll just add that we have the interpretation of the hazard ratio there, and many of these are statistically significantly elevated when we compare them to all other workers in the ODSS. You can also find that on each slide we'll have a link if you're interested in looking at sort of the publications that are associated to these findings or other lay summaries or infographics as well. So drawing on current evidence from previous observational studies and the International Agency for Research on Cancer, IARC, we're also aware that there are several physical, chemical, and infectious exposures with suspected carcinogenic effects on non-Hodgkin's lymphoma. And this is a fairly new area that we're investigating. But here you can see some of the groups where we see higher risks for NHL. And we saw higher risks for females in particular occupations such as teaching, nursing, protective services, and motor transport operating. So again, we see motor transport operating here. And we see similar findings for males as well. And again, in protective services, we know that these findings are driven by firefighters and police. There are various occupational risk factors such as benzene, radiation, trichloroethylene that's used as a metal or fabric cleaner that are possible in these occupations. But we're also interested in exploring the risk of viral infections, such as viral hepatitis. And we do see that there are some elevated risks among certain occupations for viral infections that also align with our findings. Now, the challenges with infection data, this is based on administrative health records. So we often have smaller sample sizes when we're trying to link multiple records across multiple different data sets. And so that is a limitation in our approach, but we are further investigating the risk of viral infections. Another recent analysis that we've been working on is to examine the risk of melanoma among workers. And we know that there are potential risk factors such as PCBs and solar radiation, among others, and among other non-occupational risk factors that we cannot account for in the ODSS. While non-melanoma skin cancer is more common, we know that melanoma accounts for more cancer deaths, but is also captured in the Ontario Cancer Registry, where we get our data from. So in our ODSS, we were able to identify a number of occupations with an elevated risk of melanoma, and there are some important differences by sex. Some of these findings can be attributed to solar radiation exposure, where we can see obvious connections for those employed in outdoor work. But also, there are also other factors involved that we haven't accounted for right now. And the finding, again, among protective services, we know is primarily driven by firefighters and police. We know they have a higher risk among these workers in previous studies and in the literature. We've actually recently started to examine sun exposure among workers with melanoma, so trying to apply a job exposure matrix to understand what the solar radiation exposure looks like among these workers who have an elevated risk of melanoma. So this is ongoing work, but right now what we do see is that there are elevated risks of melanoma, specifically in target areas such as the arm, the trunk, and the head, which we know may be more likely among workers such as motor transport operating. So some of the findings here are for lung cancer. So I know most people are familiar on the research on lung cancer, but few studies have really explored the relationship between occupation and lung cancer, particularly among female workers compared to males in the same occupations. So in our large worker cohort, we did see that females in various traditional high-risk occupations had elevated risks for lung cancer that are consistent with what we normally see among males in the same occupations in existing studies. And several occupations demonstrated associations for lung cancer in females with at least a 20% increased risk compared to males. And you can find more of these findings in the paper that's linked there at the bottom. And I think this is very important because it does emphasize that there are sex-based differences in lung cancer risk, particularly among these specific worker groups. We know there are obvious exposures such as asbestos or diesel engine exhaust, but we don't really have much literature on how these exposures differ by sex. And we know that there are other factors as well, such as PPE or other biological or lifestyle factors that may be attributable to the risks that we're seeing. And I'd like to add that for these, we did use an indirect adjustment for cigarette smoking. So we did our best to try to account for cigarette smoking in some way. So the last slide I'm going to share is on female reproductive cancers. So we know that, participation of women in the labor force has increased over time. We know these are specifically among those of reproductive age, but we don't really understand the impact that this has on reproductive cancers, and these are very poorly understood in the existing literature. So our results here for reproductive cancers are focused on uterine and ovarian cancers. And what we can see is particularly among more of the administrative and teaching occupations, where we also know there are more females with compensation claims in our system from these occupational groups. However, there are other groups here that are also highlighted, such as machining, so wood and metal machining, which are often you're not going to find any of this in previous literature. And so I think it's very important to highlight some of these findings where we have the ability to really dig down among the 800,000 females that are in our cohort. We know that female reproductive cancers are influenced by a variety of factors, so not just occupational risk factors, but we don't really understand the role that occupation plays. So a lot of our work is to really push future studies to look at the relationship between female workers and the risk of cancer, particularly reproductive cancer risks, and occupational exposures such as those metalworking fluids, asbestos, and even other factors such as sedentary behavior. So these are all important to consider for future studies in this area. And really, we're trying to emphasize that the risk among female workers needs to be further understood in other large cohort analyses, or where you've got sufficient sample sizes to actually look at a number of different female worker groups. But I think that it's important to see that, we're seeing this across many different cancer sites and not just the female reproductive cancers, highlighting that important role that occupation or workplace plays among cancer risks. So now that you've got all of sort of the risk estimates and a lot of the data from us, I'd like to pass it to Kate, who's going to share some of our knowledge translation activities and what we do based on some of the research that we've presented and beyond the surveillance system.
Thanks, Giovanna. So as Giovanna mentioned, I'm going to share some of the tools and resources we've developed based on the ODSS results, as well as some of the other research at OCRC and how it can impact prevention. Next slide.
Oh, 1 second. It's not letting me. There we go. Okay.
So one of OCRC's goals is, where possible, to make data openly available. And with that in mind, several years ago, we partnered with the Canadian Centre for Occupational Health and Safety to develop the Occupational Disease Statistics website. And the goal of this is to share data from the ODSS. And the website houses an interactive data tool where users can explore the data by sector or by exposure to identify worker groups with increased risks of occupational cancer or other diseases. And I've shown here on the slide the 9 sectors that are currently included on the website. You see many of the ones that Giovanna mentioned as being at increased risk of various cancers, including protective services, construction, mining, healthcare. There are other resources available on the website as well. For example, infographics like the one on the right showing some of the key results for each sector. And you can also explore by exposure, looking at occupation and industry groups with where we think there's an increased risk of exposure that could lead to specific diseases. And next slide. We're also developing a lot of infographics to share some of the main results from our analyses. So for example, on the left, I've shown an infographic on some of the occupational groups at an increased risk of leukemia, and this is based on the ODSS results. And then on the right as well, based on our ODSS analyses, we have an infographic on cancer risk that we see among paramedics, and that is one of the first studies looking at paramedics. I'm looking at Ontario paramedics, and we see a higher overall risk of cancer among paramedics compared to other workers, as well as higher risk of melanoma and prostate cancer. All right, next. We're also prioritizing collaboration with other organizations to develop tools and resources that could fill their needs. And so this is an example of a collaboration with Workplace Safety North to develop posters that share the top occupational disease risks in the mining, forestry, and pulp and paper sectors. And this is based on ODSS findings. So the caveat here is that it's only including diseases where we can look at those diseases in the ODSS. So there's some limitations here, but we found that these were very popular and just a simple way of sort of highlighting some of the important disease risks in these industries. And so these are just a few examples of the resources that we're developing to share our findings and raise awareness of occupational cancer and occupational disease in general. Next. I also want to mention a few other studies at OCRC where we see an opportunity to improve prevention. And so Ontario's Asbestos Workers Registry was created in 1986, and it requires employers to report workers' hours of type 2 and type 3 work with asbestos-containing materials. And for those who aren't familiar, type 3 work is considered the highest risk work with potential to generate high concentrations of airborne asbestos fibers. Type 1 is the lowest risk and is not required to be reported to the registry. The registry notifies workers when they reach 2,000 hours of reported work, which is approximately equal to about a year. And they're provided with information for themselves and their healthcare provider. This study is a collaboration with Dr. Victoria Arundel at the University of Toronto, and it aims to evaluate the risk of asbestos-related cancer and respiratory diseases among workers in the AWR, as well as assess its utility for occupational disease surveillance. And I'm not going to go into the results other than I will say that we do see higher risk of asbestos-related disease among these workers. But I do want to sort of take a minute to focus on the second aim and how this study of the AWR can help advance prevention. Next. So as I mentioned, workers are currently notified when they reach 2,000 hours of reported work with the registry. However, what our study found in our analyses is that there are increased rates of asbestos-related disease among workers with as little as 500 cumulative work hours. And so this to us suggests a possible opportunity to improve prevention by lowering that 2,000 hour notification threshold. And so this is something we're continuing to build evidence on, and Dr. Nathan DeBono at OCRC is working to expand this research to estimate the potential impact of lowering the threshold. So this sort of just points to how the research can lead to improved prevention and point to ways where we can really have an impact. All right, next. I also wanted to highlight a recently completed study where we measured radon levels in small to medium-sized Ontario workplaces and public buildings. And radon is the #1 cause of lung cancer among non-smokers. Exposure can occur both at home and at work, making it important both occupationally and environmentally. And so as part of this study, we went into workplaces, took measurements of radon levels, and study participants were provided with their results and information about remediation if levels were high. And we were really excited to see, without any sort of prompting, one of the study participants was really proactive. And upon receiving an elevated radon level, they proactively shut down the basement of the workplace where that measurement was taken and immediately engaged in some remediation. And so it was really great to see such a direct an immediate impact from the research study, and as well as contributing to evidence on what factors may impact radon levels or what may lead to high or elevated radon levels in workplaces. We also see immediate impacts with the participants of the study. All right, next slide. So Kimberly mentioned that we had held a workshop in partnership with Health Canada about firefighter cancer research priorities. And since Firefighter Cancer Awareness Month just ended, I wanted to mention both this and as well as some of our work related to firefighting. So we released this report last year to align with the first annual Firefighter Cancer Awareness Month. And this was based on a workshop held in partnership with Health Canada, and it included relevant stakeholders from industry, research, and government. So a very broad range of folks attended that. And workshop participants identified research gaps that they felt were really important and needed to be addressed. And so we went through the presentations, the discussions from that workshop, and I grouped those gaps into 10 key categories, which I've shown on the right. And as Kimberly sort of mentioned, I just want to point out that one of the key areas where participants in our workshop felt that there was a really big gap was in terms of knowledge translation. So getting the information that we already know out to the people who need to know it, to the services, to government, to industry. So across the board, knowledge translation was felt to be something really important to focus on. The report also recommends 4 key research priorities for Canada. So this includes studies of underrepresented populations, and in particular, wildlands firefighting was called out as an area where we need to learn more about the specific exposures and circumstances that these firefighters may face. Exposure interventions, mechanistic studies on cancer risk, and then better exposure measurement studies and exposure assessment. And this report is available on our website, and I just put the link at the bottom of the slide if you're interested in learning more about that. So next. And I just wanted to mention a few of our other studies related to firefighting. And some of these could help fill some of those gaps that were mentioned as priorities or that are needed to help advance research on cancer and firefighting. So a study of diesel engine exhaust exposure in fire halls, a study to improve respirator fit testing protocols for firefighters and paramedics, and studies of flame retardants and PFAS. And these chemicals are both present in a lot of consumer products, so they may be released into the air during a fire. As well, they may be present in firefighters' turnout gear, So both are very relevant exposures for firefighters, and PFAS is also a component of some firefighting foams. So all of those studies could potentially help us to understand, firefighters' risks, or to help improve prevention and exposure reduction strategies for firefighters. And we've also looked at cancer risks among Ontario firefighters using the Occupational Disease Surveillance System. Right, next. If you're interested in learning more about our research, we recently released our 2023-2024 annual report, which highlights progress and accomplishments from our research programs, projects, and knowledge translation initiatives. And the theme of this report was expanding our scope, and it reflects our official change from a focus purely on cancer to a focus on occupational disease more broadly, although we retain that strong focus on cancer, as well as growing research and knowledge translation capacity. And the report is also available on our website, and I really encourage anyone who's interested to kind of check it out, as it does provide a nice summary of all the things that we've been working on over the past year. And then lastly, next slide. A few of the key resources that we've mentioned are available at these links. So specifically, I want to mention our website at www.occupationalcancer.ca. I've also included several places where you can go to find resources on the occupational disease surveillance system. So on our website, the Occupational Disease Statistics website, and then Giovanna briefly mentioned that we have a project looking at opioid-related harms, and that has its own website, opioidsandwork.ca. And then for firefighting, here I've just included two sort of general links from our website that compile several different resources aimed at firefighting. And so if you're interested in the cancer risks among that group, then these are two links that could really help to bring together all the resources and research that OCRC has done in relation to firefighting. And I think that's it for me. So just wanted to say thank you on behalf of both myself and Giovanna for your attention. And I'll pass it back over to, I think Holly is next.
Yes, perfect. Thank you, Jeet. Next is going to be Holly Houston, and she'll be talking about silica exposure as well as lung cancer.
Perfect. Can you hear me all right, hopefully?
Yes, and we can see the presentation.
Awesome, thank you. Alrighty, so as alluded to a little bit earlier, and Kate, thank you for the introduction. So a little over a year ago, in November of 2023, which was Lung Cancer Awareness Month, the silica control tool in Ontario was launched. So construction workers who are exposed to silica frequently and consistently, are at risk of developing lung cancer. Oh yeah, there we go. So over 7% of workers in Ontario are employed in the construction industry, which is the largest single exposed sector to silica in Ontario. So this includes construction trade laborers, heavy equipment operators, drywallers, plumbers, and many more. And in Ontario, about 150,000 workers are exposed to silica, with about 200 lung cancer diagnoses a year being caused by exposure to silica. For construction workers, it is important to know where silica is most commonly found, because it is, or where it is commonly found because it is the most common construction worksite hazard. Because it is so common for workers They should be equipped with the knowledge to be able to detect when and how they may be exposed to silica and how they can control said exposure. So silica can be found in any of the materials listed here on the screen. So there's gravel, stone, concrete, glass, ceramics. So it's important to be aware of those materials before you're going in to work with them and how best you can control that exposure. So as we've mentioned, one of the illnesses related to silica exposure is lung cancer, but you can also experience silicosis or COPD. And some of the symptoms that go along with that would be shortness of breath, severe coughing, body weakness, and just as I mentioned earlier as well, about 200 lung cancer diagnoses a year are linked to silica exposure in Ontario. So we're aware of silica in the workplace and the hazards that are related to it. Now what can we do to protect our workers? So the silica control tool was brought to Ontario for workers to use while they're on a work site or while they're prepping to head to a site. It's a free tool that's geared toward construction workers because they are the among the highest exposed in Ontario. And the tool right now allows for construction workers to use it primarily just because of the data that we have. The tool is intended to inform workers of what their exposure levels are while they are working. So while they're drilling, sanding, or chipping, among other activities in the materials that were listed earlier, they can input their work site activities into the tool. And so it's a web-based tool that can be used on laptops, phones, tablets. So it's very much intended to be used on the go. So whether you're about to go to a job site and then you switch to another one in the afternoon, or just as the weeks go on, work sites and activities can change, and so can your exposure control plans. So it's very user-friendly. It walks you through a step-by-step of inputting your job activities to understand what the initial exposure levels are. And then it gives workers the opportunity to select what controls they can implement on their job sites. So that could include administrative controls, PPE controls, elimination and substitution controls. And when a worker has selected all that they are able to do for the day or on that job site, it'll give a new exposure limit, or exposure level, sorry. And then that will all be summarized into an exposure control plan. So when all is said and done, the worker can download the exposure control plan or can print it as well. And this is a resource for workers to refer back to on how best to minimize exposures to silica and to lessen the risk of lung cancer on the job. So we've gathered here a list of resources that are related to lung cancer and silica exposure. So you can see resources from OCRC, who we heard from, of course, just a few moments ago, IHSA, which is a great partner of ours, and a few resources there from us. You can see links to some of our own things that we've come up with. And you can also see Threads of Life, which is an amazing organization that works to heal families and contribute to ending workplace tragedies. Hopefully Kate will be able to post these in the chat just in a few moments, or I will do so once I wrap up here. Lastly, I join you to watch a video that we've created with Blue Collar Marketing to launch a new campaign, Work to Live, Tool Up for a Healthier Tomorrow. This campaign demonstrates the reality of experiencing an occupational illness and how it can impact not only the individual worker, but their family as well.
Dad, come play soccer.
Hey, Thomas. Daddy can play soccer today, okay, buddy?
Okay.
So we'll be continuing to share some more videos that we created with over the next couple of weeks in this campaign, and we're very excited to share these materials because, you know, this is a real reality for people, and we want to bring awareness to lung cancer and other occupational diseases as well. Thank you.
Awesome. Thank you, Holly. So we also just wanted to note today that the United by Unique campaign for World Cancer Day reminds us that cancer is not just a medical diagnosis. It's a deeply personal journey for each individual. Behind every diagnosis is a unique story of resilience, love, grief, healing, and so much more. That's why it's so important that we embrace a people-centered approach to cancer care, one that integrates each person's unique needs with compassion and empathy, leading to the best possible outcomes. We recognize that today's discussion may have brought up some sensitive emotions, and we want to remind everyone that support is available. For anyone impacted by cancer or workplace tragedy, please visit Threads of Life that Holly mentioned, a resource dedicated to supporting families and individuals affected by workplace fatalities, injuries, or occupational diseases. You'll find the link in the chat shortly. Now, if anyone has any questions, please feel free to raise your hand, unmute yourself, or type it in the chat, and our team are here to answer your questions. Do we have any questions?
It looks like a quiet lunch and learn group today. And we layered that with quite a bit of emotion, which we hope, and resources and tools to do something about it. So I hope, oh, we do have one. Sorry, over to you, Kate.
Perfect. So we did get a question saying, thanks for sharing the data on occupations such as teaching. Do you have any data on healthcare workers, i.e. nurses, etc.? Great, thanks. Yeah, we do. We actually do see an elevated risk for a number of different cancers among nursing occupations, particularly those that are in training, and also other staff like orderlies. So you can, across these sort of publications that we've listed and resources, we do mention some of the findings across healthcare workers. And I'm happy to share more if you're looking for something else. We also do have a publication on nurses as well, but just more broadly. And then we've got a number of different pages on our website that you'd be able to see like some of the findings by specific occupational groups within healthcare occupations.
I just
They
shared
say
one of
perfect,
the,
thank you. Yeah,
the nursing resources on our website in the chat.
Perfect. And also, would it be possible to get the slides from today's webinar? Yes, it is. Paul will be posting the video and a PDF copy of the slides either later this week or early next week. Do we have any other questions? We have a bunch of thank yous.
Tummies are growling for folks, I think, but I do want to thank this whole team, Caitlin and our friends from OCRC, Giovanna and Kate and Holly, and our whole silica control team, and everyone at OCCOW that works on these files every day. And they are not files, they are people and faces and families. And we are very proud to come together as organizations to continue to bring knowledge translation and mobilization, more importantly, to the learnings from the work that we do, and translate those learnings into prevention efforts. So I just wanted to thank everyone, and hopefully you'll be seeing and sharing some of the videos and marketing coming your way we want to replicate what happens with the silica tool. I think Melanie's here, who is the the creator of the silica control tool in British Columbia, and has been working on mining versions. Victoria Arndale is mentioned, and we see the future of tools such as this to help us with the data from all the work that the OCRC is doing to collect and do something with, to work on prevention tools and exposure and control tools through various methodologies. So we hope that this is just a snowball effect, and part of the recent reports on occupational illness prevention and the recommendations from that include highlighting occupational illness. It's a focus of the Prevention Works system partnership, and we hope these OCTAZEE's awareness campaign, it's very difficult, has been a difficult goal to have people care about occupational disease given its latency period, and the chronic nature, and the underreporting of people getting sick but not knowing that their workplace possibly, and most certainly in many cases, contributed to that. So thank you for your time today. We are united by Unique and our collaborations, and yes, thanks to all of you.
Perfect. And I just wanted to add one final note. The resources from OCRC are also posted in the chat, so you're able to now check those out as well. Awesome. Thank you everyone for your time today.
Thanks,
Bye-bye.
everyone. Bye.
Bye.
Thanks.
Thank you.